success. Now, I always say that the primary impact of sexual victimization is not medical. Some kids are injured, but most perpetrators don't intend to harm their kids because they want this to happen recurrently over time. And the primary impact is, in fact, psychological. And I tell kids that they need to see what I call the talking doctor. But one little girl said to me, shouldn't they be the listening doctor? So I'm going to introduce you to my colleague, Dr. Esther Deblinger, the listening doctor and researcher.
The listening doctor has been asked to talk, so I'm going to be very brief as well. Dr. Finkel and I have been working together for over 20 years, and I am particularly proud of the fact that we've been committed to ensuring that when children are brave enough to disclose that they've suffered sexual abuse, that they have access to the best possible services for them to recover and to enjoy full and healthy and productive lives. I have worked collaboratively with my colleagues to develop treatment approaches that do exactly that are scientifically evaluated to demonstrate that they effectively help children overcome many of the things that you heard today: post-traumatic stress disorder, chronic depression, substance abuse difficulties, and other very common problems among children who have suffered sexual abuse. We are fortunately, with the help of many colleagues, reaching children all over the world who have experienced sexual abuse. But today, I have to say, standing in front of the State House, I'm going to say something politically maybe incorrect. I'm a native New Yorker. But I've been living in New Jersey for 20 years, and I have to say that today I am perhaps most proud to be a New Jerseyan, to know that we together are taking this stance against child sexual abuse and doing something about it. I'm so proud of all of my colleagues who are part of this effort, because I think we do really have a chance here with the timing as it is, where the public is beginning to talk more openly about child sexual abuse because of the brave efforts of young children who disclosed in Pennsylvania and elsewhere. It is now in the news, and it has to continue to be in the news. And we will continue to break the silence around child sexual abuse, and I am very, very proud to be part of that effort, and I thank Russell for leading the effort. Thank you.